I'm a pharmacist and I'm also a third-year medical student. Here's what happens when I disclose that as a patient and a caregiver. There are forwards that could change how you get treated in the healthcare system faster than anything else. And I know this because I've said them. Those forwards are, I work in healthcare. I'm a pharmacist. I'm a doctor, a nurse, whatever. The thing is, those words don't necessarily get you better treatment. Sometimes they can actually do the opposite. If you're new here, hi, I'm Ida Maisie. I am a third-year medical student. Before medicine, I spent 10 years as a clinical pharmacist first. I'm also a mom of two, and my oldest has complex medical needs. So patient, caregiver, pharmacist, doctor in training. I have sat in every seat in the consult room, and I have watched multiple times how differently those seats get treated. Not because anyone's body is different, but because the vocabulary is. Whenever my son gets referred to a specialist, things play out almost predictably. Early on, I'm asking questions and I'm getting answers. Simplified, short, reassuringly. And that's not a bad thing. A lot of families want that. And honestly, most of us need that. Then medications come out and I start talking about efficacy, safety, what interactions we're looking out for. And almost instantaneously, based on the lingo that I'm using, the physician or the clinician that we're seeing tilts their head slightly and asks, are you in healthcare? And I admit it. I say, yeah, I'm a pharmacist. And I'm also in medical school right now. And almost instantaneously, the conversation shifts in some form. I'm now getting the differential. Suddenly, we're speaking in shorthand. Same mom, same kid, same chart, forwards. That's what changed everything. Now, I want to be clear. I don't think those doctors are doing anything wrong. Doctors read the room constantly. It's part of the job. What changes when I mention that I'm in healthcare isn't the care that we receive. It's the conversation. And it doesn't always shift in my favor. Some clinicians relax, shared vocabulary, less translated, keep it short and sweet. Some actually over-explain, and some under-explain. They say something like, well, you know how it is. And then, occasionally, some seem a little on guard, like the visit suddenly has an audience. So there's actually a phenomenon in medicine where special patients, quote unquote, may end up with worse outcomes. Not despite special treatment, but actually because of special treatment. It's called the VIP syndrome. And by VIP, we're talking explicitly about fellow doctors, nurses, pharmacists, anyone who works in healthcare, in direct patient care. Here's how it works. Hospitals have standards. They have processes, checklists, protocols. Those exist to keep patients safe. Standardizing our pathways is how we catch errors. It's how we avoid unnecessary treatments. And it's how we ensure that everyone, to the best of our ability, gets optimal care. But when a patient is deemed special, people can sometimes bend the pathway in good faith. For example, a step might be skipped where a colleague might go, oh, she knows all that stuff. But that miscommunication might be where an error could have been caught. Or doing an extra scan just to be thorough for a colleague. That can turn up with a false positive, which can then lead to unnecessary procedures and potential complications that could have easily been avoided. And none of this is carelessness. It's the opposite. It's people trying hard to look out for those they consider their own. But on the flip side, being considered as one of us, a special patient, does have its advantages. And those advantages lie in the conversation shift. The reason why the conversation shift happens the moment your team realizes that you are also a healthcare worker is, I believe, a similar reason why healthcare inequities exist. Let me explain. Care provision, the care that we provide, responds to perceived competence. So when the team sees you as competent, you will get direct conversation, you will get candor, you get a partnership, you will get a collaborative environment where you're making decisions together as a team. You as the patient directly fall within the center, the person-centered care that we advocate for becomes heightened when you're perceived as competent. But when the system perceives you as less competent, and the system draws that conclusion based on your race, your ethnicity, class, and language, those factors, those health determinants can lead one to perceive you as either competent or not. And there's a scoping review that showed this, that patients who are perceived as less competent by their care team receive more paternalistic communication. But the thing is, you don't have to have a healthcare degree and you don't have to work in healthcare in order to approach your care team with confidence. I think healthcare worker patients have three things that serve in their favor: fluency, confidence, and the assumption of competence. And all of them are learnable. So here's how you learn this. So the first thing you want to do when you go for your appointment is open the visit with a clear sentence. State your goal out loud in the first 30 seconds. I'm here because these headaches are getting worse and I'm concerned that it might be something serious. That's it. People who state their concerns early get more engagement. Don't beat around the bush, go straight, be assertive, say, here's why I'm here. This is what I'm concerned about, and here's why I'm concerned about it. And then you ask these three questions. What's the most likely cause? What else could it be? It falls under the same question. What is it that would change the plan? What would make you suspect that it's something else? And what should make me come back sooner? You don't need to say a single medical term. Those three questions provide your physician the insights that you are reasoning. And then get the safety net. My family does this all the time with our son. Whenever we're leaving an appointment and we've been referred to another specialist or there's a lab that we have to do, we always ask, if the test is abnormal, who calls us? And if we don't hear from you, should we be following up? These follow-up questions have saved us countless of lost results or referrals that didn't go through. We never assume that no news is good news. We always follow through to make sure that everything comes full circle. And this one people don't do, but I promise you it's an effective way to get your voice heard, is to say the plan back out loud. If it's a medication, you repeat it. Okay, so twice a day, and I should come back on Friday if there's no improvement or if it gets worse. Say it back. Healthcare, we call this the teach back tool. It's an effective tool. It's a safety tool that ensures that you and your care team are on the same page. And then don't talk yourself down before they assess you. So don't say, it's probably nothing, sorry to bother you. You haven't been assessed, you don't have the tools to assess yourself. So don't shut it down or lead with, I'm pretty sure it's X. How do you know? State your concerns and let the workup be the workup. I also think that being a healthcare worker patient can harm us as patients. So I am a pharmacist, I'm a medical student, and as a patient, I'm very cognizant of what I say. We always hear that healthcare workers make the worst patients, and it's not because of arrogance, but more so because sometimes our knowledge and our skills get in the way. We minimize, oh, I'm sure it's fine, not a big deal. We do curbside medicine, send a colleague a picture of a rash, like, what do you think this is? Things that we tell patients not to do, we feel that because we have the knowledge and skills, we could do them. And sometimes we skip screenings that we encourage patients to follow up on and follow. So what I do at the start of every appointment is say, just so you know, I am a pharmacist, I'm in medical school, so you can use medical terms. However, that's where it stops. I don't know anything. Okay, I know nothing. I may have some thoughts and I'll express them during the conversation, but you're my care team. The only reason I'm disclosing my professional background is so you can use terms freely without being concerned that I won't understand. And even then, I make it very clear, I work in cardiology as a pharmacist, so I know nothing about neurology. So there might be terms that you might need to explain to me because I don't know them. It's not my area of expertise. And two more things that earn the keep. One is, if I'm concerned, I try to separate what I see from what I think. So I wouldn't say, I think this is sepsis. I haven't run any blood work. I haven't done any workup for me to draw that conclusion. What I would say, especially when it comes to my son, I would say, this is not his baseline. He's usually X, Y, and Z. And for the past couple of days, he's been drowsy. He's not eating and very difficult to wake up. That's not me saying he has sepsis. That's me telling them a change in his baseline. Observations are hard to argue with. And when I'm not reassured, I escalate to clarity. I'll say something like, I'm not feeling settled yet. Not because I disagree, but because I don't think I quite understand why we are not ruling out this in this situation. Can you walk me through that? And I found that that question has never made a conversation worse. Instead, it's opened up the conversation to say, I'm sure you're right, so I'm not saying I disagree, but I'm having a hard time understanding, especially this thing that I'm concerned about that you don't think I should be worried about. Like, walk me through it. Why shouldn't I be worried about it? And I think that that's a very important thing to help you feel settled and not feel dismissed. So if this one hits home and you found it helpful, the questions, the safety net, and the tips I provided are in the description below, written out so you can screenshot them and bring it to your next appointment. And if there's anyone you know whom you think might benefit from this, share the video. It's why I made it. And let me know in the comment section, are you a healthcare worker patient or know a patient who is also a healthcare worker? Let me know what your experiences have been like navigating the healthcare system with this combination of roles. I would love to hear them. I read every comment, and I really hope you enjoyed this episode. I'll see you next time. Bye.